Hi, I'm Dr. Atish Karazian, and I want to talk to you about why many patients that have depression do not respond to antidepressants and actually don't respond to even natural compounds that impact the neurotransmitter pathways like 5-HTP or St. John's wort or other natural agents. One of the things that we've learned in recent years is that depression, especially chronic major depressive disorder, is actually due to what's called the cytokine model of depression or an inflammatory model. So when the brain becomes inflamed, it shuts down its activity. When the brain becomes inflamed, several key things happen. First of all, inflammation slows down nerve conductance. So your neurons are firing at a certain speed. When there's inflammation in the brain, the conduction speed of nerves slows down. And when areas of the frontal lobe and limbic lobe decrease their frequency of firing, that leads to depression. We also know that inflammation disrupts transport of carrier proteins. One particular one is large neutral amino acid transporter. It's really what's involved with carrying precursors for dopamine production and serotonin production to the brain. So inflammatory states disrupt this mechanism in which precursor amino acids can cross the blood-brain barrier in order to be used to synthesize neurotransmitters. And as dopamine levels go down, people lose their motivation and drive. As serotonin levels go down, people lose their mood and their motivation to be happy and to do things. And this creates this chronic pattern that may look like a neurotransmitter problem, but in fact doing anything for neurotransmitters has really no effect. The other thing that takes place in chronic inflammation is that the actual receptor sites that respond to a neurotransmitter at the postsynaptic cleft, they lose their signal transduction pathway, so they're not able to carry the messages that take place even when neurotransmitters or agonist compounds, whether pharmaceutical or natural, bind to them. They just simply can't carry out the message. So one of the key mechanisms that is involved with chronic unresponsive depression is a neuroinflammatory cascade. So what do you do about it? And this is a key clinical question. I can tell you it's not as simple as just taking some anti-inflammatories or just reducing inflammatory foods from your diet. When people have inflammation, what's going on, or chronic brain inflammation, their microglial cells are primed. Something has turned them on. It could be a combination of factors. So what I'm going to do in my course coming up on neuroinflammation is I'm going to teach practitioners how to go through and find each of these mechanisms. You got to start with history, and you got to go through your exam, you got to go through laboratory, and then you'll be able to look at all the different mechanisms that drive brain inflammation and chronic depression. There's 4 known pathways into the brain that cause inflammation, and that's not even including breach of the blood-brain barrier, which is its own separate pathway that can cause the brain to be inflamed. But just know this: the next time you see a patient that comes in completely depressed, unresponsive to any type of antidepressant, is fatigued, is tired, has very little motivation, you should be thinking neuroinflammation, and you should know the strategies to totally unravel this chronic mechanism. So we'll be going over all that in our course, and I think if you attend, you'll be able to really learn effective strategies to help these patients that are suffering and really have very few options in the current healthcare system. Thank you.